Our daughter Rebecca was diagnosed with type 1 diabetes when she was 2 years old. So when it came time to send her to kindergarten, that was going to be a very different environment for us. I reached out to Andrea, who I knew through my other children in the school corporation, and asked what we needed to do, as well as working with the doctor's office. And really in that beginning process learned that the care in the school systems for type 1 was not really up to what I felt was best for Rebecca in the school setting.
As a school nurse, when I hear that someone may have questions or concerns about our ability to meet their child's healthcare needs, it's really important for us to assess the situation, ask questions, find out the specific needs of this child. Because we know every student is going to be different. School nurses in our district had a number of students that we cared for with type 1 diabetes. And we realized that we needed to improve the way we were able to communicate with our students' healthcare provider, especially when it came to their type 1 diabetes care needs. We realized that we really needed documentation that would reflect the specific needs of our students. We also needed a way that we could get a hold of their healthcare provider and healthcare team as quickly as possible when we had concerns or when there were notable changes to their plan of care. So I reached out to Heather as a nurse practitioner, and during our conversation, she volunteered to come and do training. And during the training, we talked about the need to standardize our documentation forms. Several of the school nurses brought up the concern that they had had difficulty being able to communicate in a timely fashion. And so during this training, Heather and I began to discuss the need for a new way to communicate.
We worked with the different school districts, the ones that we have most of our kids at, and kind of developed a more comprehensive but fewer page form that encompassed everything we needed for these students to make sure that they got consistent care at school from what they would get at home. And then we took it to all the other different counties around us to make sure that everybody kind of, oh yeah, this works great, let's use this. And then we set a couple of our diabetes educators and kind of made them our point person for who the nurses would call when they had issues or when they needed to talk to somebody. And I got all of our providers to make sure that when they changed the dose and the kids were in the office, to let the educators know. So then they could preemptively go on and send that fax, get that sent over to make sure that the care was the same, no matter if the kid was at home or at school.
The communication improved drastically when we were able to come together and share each other's needs and wants for our forms and for our communication pathway. We were able to develop a system where I could serve as a point of contact for the school system. If they needed to get a hold of a school nurse right away, they didn't have to know every single school nurse's name, phone number, email address. We made sure that that content was built into the forms so that right away at the beginning of each school year, parents were reading the HIPAA and FERPA release and signing that and making sure that we could communicate between the healthcare provider and the school effectively as well as legally.
So by having the forms directly sent from the Diabetes Institute, we no longer had to be concerned about waiting on anything. We knew that they were handled directly between the office and the school corporation. So it's been a tremendous just time saving and just one less thing we had to be concerned about to get ready for the start of the school year.
These forms gave me the ability to keep my stuff with me if I chose that. And it has helped me through all of my years of school because it has allowed me to be more independent in taking care of myself. And as I'm getting ready to go off to college in a couple months, I feel safer that I know more about how to keep myself healthy.
And so I just encourage everyone to keep those communication lines open because we can all learn about how we can better care for students with type 1 diabetes.